So we're going to start with the maxillary central incisors, and this is tooth numbers 8 and 9, and they're going to typically erupt around 7 to 8 years of age. And a way you can distinguish if this is if it's tooth number 8 or 9, or the right or left central incisor, is if you look right here. So the first thing we notice is that there's a 90-degree right here, and this side is more rounded. And as a result, the rounded side is always the distal side, and the acute side is the mesial side. So if you were to think in your mouth, this tooth that I've drawn here is actually tooth number 8. Next, let's look at the crown itself. So the crown, if you were to kind of feel your teeth, you'll see that mesial distally, this is one of the widest teeth of your incisors. When we compare the other incisors, this tooth is significantly wider. And if we look at it from cervical to incisal, we'll see that it has one of the longest. It's one of the longest incisors in terms of the height of the crown. Now, if we think about where it's contacting, so now if we imagine the other incisor here, the other central incisor, we would expect that the point of contact is going to be at the incisal third. And then on the distal side, it's going to be slightly lower, because if you think about the other tooth, it's actually going to be a little bit shorter of a tooth, and so the actual contact is going to be somewhere around here, while this one has the contact here. So this is the incisal 1/3, and this one's actually going to be the junction of the incisal and middle 1/3. Now I hope that makes sense, because it's not too hard. And then also, if you remember from the general video on incisors, that there is mamelons present. That's why we have these 3 things here, or the 3 mamelons right here. And from the developmental lobes, if you remember in the last lecture, I went over that there's 4 developmental lobes, 3 from the mamelons and 1 from the cingulum that I've drawn right here. Since we're on the cingulum, if you notice that the cingulum, it's not exactly centered to the root. It's actually a little bit more distal. So one of the features that you should note for the maxillary central is that it is going to be off-center, so it's going to be distal. And you're going to see in other teeth or other incisors that this is not the case. Some of the incisors are going to be right down the middle, some of them are going to be slightly. There's only 2 that you have to worry about. The mandibular laterals and the maxillary centrals are going to have the distal. The rest are going to be centered. Now if we were to look at the height of contour, so let's look at this mesial view. We see that there's a height of contour that's in the same spot for the facial as well as the lingual views. They're both going to be around the cervical third. Now, a typical test question that's going to come up, so we already know for our HOC, as I said, it's the cervical 1/3. Now, one of the test questions that typically come up is the coronal dimensions. So I'm going to actually write it right here. So the coronal dimensions is going to be IC, MD, FL. So basically what this is saying is that if we look at the incisal cervical, it's going to be greater than the mesial distal, And now if we compare the lastly to the facial lingual, which is going to be the smallest. So that's pretty straightforward. I mean, it kind of makes sense. And if you ever forget it, just use your own teeth. So if I were to put my tongue at the incisal edge and go down and compare it to the other incisors, I'm going to see that this is the greatest coronal dimension. If I do the same for the mesial distal, I'm going to see that it's the next largest, and last is facial lingual. For the incisors, facial lingual is going to always be smaller, or smallest, on the maxillary centrals and the laterals. You can basically memorize this for the maxillary. So if you see a question about maxillary central incisors, or the maxillary incisors in general, it's always going to be this. Incisal cervical is going to be greater than mesial distal, which is greater than facial lingual. This is not going to be the same for the mandibulars. So just commit this to memory for the coronal dimensions of the maxillary teeth. Now, it's a little hard when drawing, but if we were to look at the lingual, we're going to see a slight distal lingual twist, meaning that this spot right here, the distal portion, towards the lingual, we're going to see a slight curvature. And if we were to put our tongue up to our teeth, on the distal side, we're going to see that this side curves slightly. It's not going to be as pronounced as the mandibular lateral, but it is the slightest. It's fairly slight, so just keep that in mind in case that comes up on the test. But it's more likely they're going to ask about the mandibular laterals versus the maxillary centrals. Now, seeing that this is the largest tooth, you'd expect that there's going to be a large lingual fossa. That's kind of a given. And also the shape, if we look at it, if we were to kind of draw the outline, you can almost see that it's kind of trapezoidal. So if we look at this right here, it sort of looks like a trapezoid. As I said in the beginning, the mesial incisal and distal incisal angles, the mesial incisal is a 90, while the distal is going to be slightly rounded. Now if we look at the CEJ, or the cemento-enamel junction, now if we're going to look at the facial, we're going to see that it's convex. Now let's look at the lingual side. Now my drawing is a little bit, it's not as good, but it's still, if we were to compare the lingual to the facial, the lingual is actually slightly less convex. But on the test, just know that the lingual and labial are both going to be convex with respect to the root. Now the mesial distal is this, it's going to be the same thing. The only difference is now we have a concave look to it. Now if we think about the fact that this is an embrasure right here, and right here we're going to have gums. And so our gums are basically going to come up to here, and you can almost say that the gums kind of create this outline. So that's an easy way to remember how that the mesial and distal are going to be concave with respect to the root, while the lingual and facial, or labial, whichever one you want to call it, is going to be convex. If you remember before, I mentioned that the incisors typically look like a shovel. So if we look right here, it has this sort of wedge-shaped look to it. And that's another one of those test questions that occasionally come up. And then lastly, and I didn't draw this well enough, now if we were to look at the root right here, we'd actually have this portion coming down at us. And as it's coming down, we're going to see that this is going to almost create a triangular shape. So if we were to cut the root kind of along here, so if we were to cut the root in half, what we're going to see is that the root of the maxillary centrals is actually more like a triangular shape through the cross sections. Now this is not the same for the maxillary laterals, which is ovoid. So just remember that this is a triangular cross section. And then lastly, I know I've drawn here these slight depressions. When you're actually looking at the teeth, you're not going to see a pronounced depression. So don't really, don't take this as like a real depression. So there's not really any depressions there. This is basically the gist of the maxillary central incisors. Next we're going to go into the maxillary laterals. If you like this video, please hit the little thumbs up sign below. If you like the channel, please subscribe. If you have any questions, comments, please write it in the box below.